You're listening to the Hope Not Nope podcast
with Doc Dylan
and Brandy.
We empower high performers with a three-part strategy of hope,
Self-agency, goals, and proven frameworks,
so that you can reach your potential
and the highest quality of life. How's it going? Thanks for tuning into this episode of the Hope Not Nope podcast. A few weeks ago, Dylan, if you remember, we did an episode that was essentially, can AI replace strength coaches or fitness coaches at some point in
Robo Coach.
Do you remember that episode?
I do remember that episode.
Awesome, because this question came in as a follow-up.
Wasn't it Arnold that was RoboCop?
I've never seen that.
Gotcha. All right.
Added to the list.
Add to the list.
We discovered this morning that I've never seen Mighty Ducks, and he was completely appalled, and so added to the list. Okay. Well, anyways, this question is basically a follow-up from that question, but I think you're going to like it because you fit this bubble.
Okay.
All right. So Miranda says, I enjoyed your episode on AI and strength coaches' jobs. My question is the same idea, but in healthcare and specifically with physical therapists. See how it's about you because you're a physical therapist?
Man versus machine.
Man versus
machine.
Do you think that with AI becoming more advanced, it could realistically replace physical therapists in the future, or will there always be a need for human element?
Well, Miranda, thank you for listening to that podcast with AI and strength coaches and submitting that question. I think the answer is going to be very similar to what was in that episode, in that it has potential to be helpful for a physical therapist or healthcare provider, but it does not have the ability to realistically take over that position for a lot of reasons. And we'll dive into those reasons. But I think first, let's start with just this overview of understanding a bit more of how AI works. And I'm not going to pretend that I know the full algorithm and all that, because like if I did, our business would be a lot different.
We probably would have a different type of business
than what we're doing. But from using it and researching with it and teaching students about how to use it and when not to use it, I can give you some insight to where we're at right now. So I struggle with the idea of it like AI, artificial intelligence, of it being the name I kind of struggle with, like artificial and it's being intelligent, right? I think when we look at the intelligent part of it, what's intelligent is how fast it's able to process through what already exists.
Yeah.
It's not creating something new. It has to take what already exists on Google, Yahoo, just the interweb, and it pulls all this stuff and then it says, here's the answer to that based off of all these things that I look through. So it's not creating anything new, it's pulling from that. So what is it pulling from? Well, it's not just pulling from sports science or medical literature or peer-reviewed journals. It's pulling from Reddit, it's pulling from Instagram, and it's pulling from popular blogs and popular healthcare companies. Now just ask yourself for a second, scrolling through social media or Reddit, how credible are those sources that you are pulling from? Not that credible. And AI is not sorting through that to see. They're seeing, hey, if this one's more popular, if this one had more reach, then it happened for a reason. And let me use that to now give this info. It's also looking at credibility and credentialing of where the stuff comes from. But again, it's not always the best source for that. And I think we could go through an example.
Yeah, let's do that.
With that. And one that I use two with students. One is IT Band and another one is Shin, Splints, because they're the two, I don't want to say two of the biggest, but two of the most misunderstood and mistreated, especially when we look at what's being posted on blogs and Google and social media. So what are we thinking? Shin Splints or IT Band?
Let's do Shin Splints.
Okay. So Shin Splints, if you go on social media, if you go on YouTube, if you go on Reddit, if you go on a lot of different blogs, what you'll find is shin splints being defined as a tibialis anterior issue, a tibialis anterior overuse. And that in order to prevent it or in order to treat it in rehab, that you have to now strengthen the tib anterior by doing this different series of tib anterior raises. The tibialis anterior it's a muscle on the front of the leg runs down the shin, goes down to the foot. It basically is this muscle that helps you prevent your foot from dropping when
Mm.
it's in the air. So when people have an injury to the nerve that serves that muscle, their foot, their toes kind of drag on the ground when they're going through a swing phase of it. So the tib anterior helps keep the foot up in the ground when you're running. Now, the total force production that it has during running is very low compared to other muscles in the leg, like the calf, for example, the soleus complex, the triceps surae, the calf, and the soleus together. About 60% of the running force comes from pushing
Mm.
off of the ground using the calf musculature. The calf has mechanical advantage. The calf needs to be strong. The calf needs to be robust. The calf needs to be resilient. Yet we blame this small muscle on the front of the leg and say that this is what's causing it. It's the equivalent of causing a headache on an eyebrow.
Mm.
Just because it's in the same area doesn't mean that that's what's creating this. So then what are shin splints? Well, shin splints is kind of a slang term for lack of a better word, but shin splints it's a medial tibial stress syndrome. And when we look at medial tibial stress syndrome, there's two leading theories in it, but one is a little bit more accepted versus the other one. The one that's starting to be challenged a bit more is the idea of that this is a posterior tibialis overuse injury, which is a plantar flexor, which is the same job as the calf of pushing off. So that's one. In either case, if it's a posterior tib versus anterior tib, is going to be treated a little bit different. But more so than that is that medial tibial stress syndrome, aka shin splint, is likely an overuse of the bone,
Mm.
a bone stress injury, lower level of, I don't want to use the word stress
I was gonna
fracture.
say it's not a stress
It's not a
fracture,
stress
but
fracture, but the bone is irritated.
yeah.
The periosteum of the bone is being irritated. You need to stop irritating it. So what's the treatment for that? Well, one, it likely happened because the shin or the tibia took on too much load too soon.
Hmm.
It didn't have proper progression. That's one reason. Another reason might be that the calf was not ready for that. It wasn't helping with the force. It wasn't helping absorb some of the forces. Like there's some strength, there's some elastic capabilities that needed to be developed that weren't developed, and you started running too far or too long, too soon. Another potential thing could be that you are in a caloric deficit,
Mm.
which happens often if you're an avid rucker or distance runner, that you're not getting the amount of calories that you need. If you're not getting the amount of calories that you need, your risk of a bone stress injury goes up significantly
Friendly reminder, you need at least 100 calories per mile
per mile
added onto your maintenance calories.
onto your BMR, your
Yeah.
basal metabolic rate, what you're burning just at rest in your workout. Of every mile you go, you're going to need around that extra 100 calories. Like
Hmm.
you have to fuel. And the issue is when we look at and we derive these things from AI that says, oh, no, it's a tib anterior. Do your tib anterior raises, you'll be good to go. Well, you don't realize that, oh, you're not fueling appropriately,
Hmm.
that this can actually become worse if you continue to try to train on it, thinking that, oh, well, it's a muscle thing, so I can kind of like bring my volume down and keep going. Like, no, this is a bone stress injury. You need to rest. And it's one of the few injuries that that's the recommendation is rest. A
Yeah.
lot of times that's not the recommendation anymore. But if it's a bone stress injury, you got to offload it and give it a chance to recover and then start loading it again. Now, it doesn't mean complete rest, right? You can still train other parts of your body, but it means, hey, the tibia is not doing great, this part of it. So we have to deload it or it's going to get worse.
Could quote unquote tibialis raises help or hurt? Like, could they hurt the situation because you should really be resting versus like putting load on it? And would those potential exercises like create harm?
Not not a tib anterior raise like offloaded. Like if
Hmm.
you're sitting on a bench or a box and you got a kettlebell around your foot and you're going into dorsiflexion and training it, you're not going to create harm to that area. You're training
Gotcha.
around the leg, and part of that, yeah, some of that can be helpful. What's harmful is thinking that you can continue to train and run and do
But
other
and
types
just
of training.
supplementing with that
And
like little movement, but in
exactly.
reality, you're like, yeah,
Right.
gotcha.
Yep.
Thank you.
Yeah. Yeah. So that's just one small example of Ask AI. This is what's going to pull.
Hmm.
It's going to say, oh, tib anterior, do this, do foam rolling to your tib anterior, soft tissue releases. no, you've diagnosed it incorrectly. And the
Hmm.
management strategy is matching your mismatched diagnosis, which now can lead to more harm if it's not being educated and treated appropriately.
Right.
So, that little asterisk at the bottom that says AI can make mistakes. Yeah, let's not make that with something
Yeah.
associated with your overall health. So that's just one thing. And then again, it's pulling from these major sources, and some are more credible than other ones, but a lot of these bigger sources are pretty outdated.
Hmm.
And a quick example I can give there is like if we look at something like the Cleveland Clinic or Mayo Clinic or these big organizations, you'd be like, yeah, they got it going on, and they do. Like
Yeah.
they definitely do. But you got to remember when some of these blogs were written and where the evidence is at now of if you go on and you search for IT ban, it will say, oh, you need to stretch your IT ban. Well, we have research from 2000 and on saying you cannot physiologically stretch the IT band.
Right.
You can't do it. And the management of it is different than thinking that you need to stretch this thing. So, yeah, I'm not seeing the possibility of AI fully replacing it. And another quick example, can you pull up my phone? And I was working on this the other day. Uh, and I saved it because I wanted to put it in the presentation that I do with the students. But I was having a conversation with AI because I research and then I cross-reference it to AI just to see where it's
Yeah.
at,
You
right?
like to kind of play the game of it
I
too.
like to play the game of it. And we were going back and forth, and it was just very outdated. And I challenged AI, and this is what it responded. The reason I've been stumbling is that I was falling into a common AI trap. Instead of rigorously analyzing the foundational physics and biology from the start, I relied on the most common recycled medical narratives found across the internet. Each time you push back, I had to course correct because your understanding of joint mechanics and tissue biology is actually grounded in modern evidence based sports medicine, whereas the general internet text I trained on is saturated with outdated orthopedic dogma and marketing hype.
Oh my goodness.
That was straight from Gemini.
Wow. Gemini just basically said, I'm an idiot.
Right. So I think that
Wow.
is a great example of why this isn't able to fully replace the
Yeah.
human. Can it replace some of the humans that are very outdated in the field? Yeah,
Yeah.
but like, is that really an upgrade?
Hmm.
No. And if we're using something, then it should upgrade the service that we're adding to it. I think the last point I want to add into this too of why I don't see AI replacing the human is that across the research in physical therapy and rehab and just healthcare as a whole, the most likely reason a person has a successful outcome is patient rapport.
Mm.
Taking treatment methodology out of it, and this is why we see a lot of placebo-based treatments work,
Mm.
is because of the rapport and the trust that
Like the providers bringing safety.
providers bringing safety.
Mm.
They're caring for an individual who is asking to be cared for. They're providing some type of certainty, whether it's truth or not. They're providing certainty in an uncertain situation.
They have
And
good bedside
they have
man.
good bedside manner.
Yeah.
So you can take a very effective treatment and have someone administer it that's really crabby and grumpy
Mhm.
and not have a great outcome. You can take a treatment that doesn't show to be effective and have a person that's very bubbly and caring and loving and administer it, and the person can have a perceived outcome from that.
Mm.
So rapport and trust is the biggest factor underlying a successful outcome,
Hmm.
which I don't think artificial intelligence is able to replace.
Yeah, well, I honestly think that Pope Leo said it this past May really well. Like he there's a whole document that's pages and pages long on his take on like AI and technology and how it affects the human and all these things. And one of the things that he said, and I'm paraphrasing obviously because I can't remember memorize everything, or most things, but paraphrasing what he said was AI can be utilized, but it can never replace human wisdom, human compassion, human understanding, and really like the depth of what that is. It can't replace human wonder.
Yeah.
And within the healthcare system and just really any work, any job when you're interacting with people, having wisdom and wonder and care and compassion, like those things matter and
Yeah.
are very, very, very important more than a quick AI thing, you
Yeah.
know?
Yeah. And I'll give two quick examples of this as well because you nailed it, but we have to factor in trust rapport and psychosocial variables related
Yes,
to rehab,
yes.
right? There's fascinating research in the case of, we talked about shin splints being medial tibial stress syndrome, a patellar tendinopathy, sometimes known as jumper's knee, that teenagers tend to develop in not Osgood slaughters where they hit a growth spurt and the growth plate is irritated and the tendon hasn't quite caught up to length yet, but just pure jumper's knee is thought to be an overload issue of the patellar tendon in jumping sports, whether it's volleyball, basketball, name it, whatever. But so the thought is there's something structurally going on with the tendon, and when we load it, the tendon is going to change, and when the tendon changes, pain will go away. Part of that's true. We load the tendon. The research shows that the tendon has changed. But what's interesting, and Rich Willey has been the researcher at the University of Montana, has done a lot of this work, is that the tendon can change, but the pain doesn't necessarily go away.
Mm,
The tendon can change and pain can go away, or the tendon can change and pain doesn't go away. Because pain is more complex than that.
yeah.
And I don't think AI is going to have the ability to pick up on that unless a bunch of articles are being written about it and it's able to pull
Mm,
from that. But now AI has to balance that part of it of, well, is this a mechanical issue? Is this a psychosocial issue? And how do we address both? And really treating and working with individuals, human to human, it's an art and a science. The science continues to be there. The hard part is the art.
mhm,
How do you get to understanding that this is a load issue mechanically, or there's other factors going on that's creating this response, and that's what we need to address.
mhm.
And I think that gets tricky for it to do that. Now, another thing I want to bring up too is that part of what you're doing as a human is you're trying to get the full story, right? You're trying to understand, well, when do these symptoms come on? Why did you have them? What's been done already? What's the path forward? And you're trying to piece all of this together. And I'll just share one quick example of this of most people when they have an issue and they go on to AI, they're going to say, my shoulder hurts. I think it's a rotator cuff issue, which they'll probably say it's a rotor cup issue. What do I do for this? And AI is going to go, oh, it's so common that that comes up. I'm sorry that you're dealing with that. Here are the best exercises to help with a rotator cuff issue.
Mhm.
Okay, great. Well, one individual I worked with before was put on a new medication 2 weeks prior to when he started to experience shoulder issues. There's no mechanism of injury. There's no change in life circumstances other than the new medication. And there was no change in working out stimulus. There wasn't anything that was like, no, I chopped down 3 trees last weekend and now
Mhm.
my shoulders bother me. He's like, nothing has changed. I just started to experience this pain. Well, we go through the evaluation and I'm like, it's not adding up. We're moving this way, there's no issue. We move this way, there's no issue. I have you contract this, doesn't matter. You're feeling the same thing. So what the heck is going on? Oh, wow, there's this new medication you were put on 2 weeks ago. Oh, wow, one of the main side effects of this is arthralgia and myalgia, which is muscle pain and joint pain.
Mm.
Hey, you don't need exercises. We need you to contact that prescribing physician and say, hey, this dosage might be too high. Is there any other ways that we can go about this? Like, this is no longer in my lane
Yeah.
of treatment anymore. And the reason that that was found out was from doing a full evaluation and not just going, oh, your shoulder hurts? Here's what you do.
Right. AI gets rid of the intuition.
Yeah.
And as a physical therapist, you're you're taught hopefully to look at the big picture, but then also in your reps as you're practicing over the years, you gain an intuition of one, knowing what questions to ask and things like that, but then also seeing patterns
Yeah.
that people have. And I think of the example that you just shared, and that person, most people without a medical understanding or any medical knowledge wouldn't think to say like, "Oh, AI, I also just started a new medication." Like
Mhm.
they're tunnel visioned on the discomfort that they're experiencing,
Yeah.
where a provider is able to look at the big picture, they're able to think intuitively, they're able to connect dots that AI is just not there yet. And I don't know even if it got there, if it would do that. Like
Mhm.
I can't imagine AI getting to a place of, well, it could be these five different things because that's not really helping the person.
Right.
It's just creating more uncertainty and confusion. And
Yeah.
AI doesn't want to do that,
Right.
obviously. So yeah, that's interesting.
Yeah. Yeah. It's
Are there ways that I don't want this to be an episode where we're just bashing on
yeah.
AI
Yep.
because like it can be helpful. And from a physical therapist point of view, are there ways that you can see it being helpful for you and or the people that you and your field work with?
100%. If we sat down 10 therapists, 10 physicians, 10 PAs, 10 NPs, 10 nurses, RNs, CNAs, LPNs, like name the individual. If we sat them down and we said, what are the best parts of your job and your career? Hands down, they're going to say helping individuals, caring for people, and continued growth and learning.
Hmm.
Well, what gets in the way of continued growth and learning? Um, all the tasks I need to do outside of this that are part of it, as far as documentation.
Yeah.
What takes away the most time for you from being able to feel like you can truly care for the person? Documentation,
Taking notes.
all the notes, and like I don't want to like notes are a good thing.
Yeah,
Like
yeah, yeah.
we
Of
need
course.
notes, but some of the requirements have gotten so out of hand from a like bureaucracy standpoint
Hmm.
of just taking more time to do that, which is taken away from being able to treat patients.
Hmm.
And I remember fresh out of school, phenomenal mentor, and was similar to that email that not the email, but what I saved in the email from the draft of AI saying, "Yeah, I'm not up to date with these things." I, for the most part, neither are insurance companies.
Hmm.
And I remember my mentor multiple times having to be on a phone call with the insurance company explaining why this needs to be reimbursed because it's actually evidence based. And most of the people that are submitting things doing ultrasound, electrical stimulation, heat and ice, of why that's outdated. And by the way, here's our clinical practice guidelines that shows that what we're doing
It's wild.
is up to date and why this should be reimbursed and why the other one shouldn't be reimbursed. And then the insurance company going, wow, that's very informative. Thank you for that. And it was like, did my note not show that?
Hmm.
Okay, now I need to show that in my note every time in order for this to get reimbursed
Hmm.
from that. So that's what providers are kind of up against is
Yeah.
one defensible documentation from the society that's gotten sue happy, which part of that is understandable if it was like a complete medical error, a
Hmm.
flawed handoff. There's a stat that is in our book, and it's from 2000, but there was 98,000 lives that were lost just due to flawed handoffs in
Wow.
the medical system,
That's terrible.
and that's just pure human error, whether it's documentation, whether it's administrative, whether it's not checking the boxes.
Mhm.
And AI, I think, can have a huge help
Yeah.
in that and helping that to make sure that we're not having flawed handoffs, that there's a framework built that is what's necessary for a successful handoff is actually completed. So now that the person is getting better care.
Hmm.
Because that's crazy to me that 98,000 people in 2000 when this report was released lost their life strictly just due to flawed handoffs.
There was less AI then,
There's less
and
AI
I'm
then.
I'm not assuming that like I don't know what the system is these days, and I probably never will because that's
Mhm.
just not my lane. But hopefully they're already using AI to make sure that that number is down each year, you know.
Yeah. Yeah. So I think that can be helpful there with documentation and stuff like that. And every full-time clinician is like, yes, please help me with documentation.
Yeah, also just like really simple things like calendars
Hmm.
and staying organized and stuff like that. Like AI can be really helpful for that, but when it comes to like one-on-one care, people need people.
Yeah.
At the end of the day, people need people.
Yeah, they need people. There was I was at a conference, it was a while ago, but it was interesting in that the healing of an individual starts when they call the office.
Mm,
One, from a courage standpoint, but two, when they get to speak to another human that is helpful
yeah.
on that end of the phone. Because the presentation went into that basically the physical therapy doesn't start the initial evaluation. It starts when they call to make the appointment.
Mm,
So if you have someone that's rude on the line, like imagine this person, they're in chronic low back pain and they've been bounced around through the system and they're like, hey, you got to call, make an appointment. They call, make the appointment, and the person picks up and goes, all right, you want an appointment when you want it.
yeah.
All right, bring your license, bring your referral, bring this, bring that. All
Mm,
right, we'll see you then. Versus like, oh, absolutely. Okay, yeah, let's get you in. Who is there anyone that you want to work with in particular?
hmm
And takes the time to talk. Like that clinic that I worked at had
I was just thinking
the
that.
best front
Didn't
office
didn't your
person.
mom call just to like
My mom would call just to talk to her because of how joyful she was.
that's awesome.
And when people came in and they called or they were leaving, that was the first voice that they heard and the last voice that they heard.
Hmm.
And how impactful it is to have the right people in place for that to happen.
Yeah.
And we're seeing it more and more of like AI helping with scheduling. Hey, there's benefits to that, but there's also that part of it too. They're not getting that part of it.
Yeah.
And the pros and cons could go on and on and on
Yeah.
and debated. So we won't go there, but it'll be interesting to see where things go. And again, I think AI is going to be helpful a lot too for potential data tracking
Hmm.
of like, hey, this is the population I'm working with, and we're using up-to-date measures. Typically for a collegiate athlete playing Division I football, what's the typical quad force output that they have? Okay, cool. Can you find that, track that, and then go to that? Given that it's using the medical literature
Yeah.
to do that.
Right. Well, the one thing, and I think this is the last point before we just hop into hope stories, but the one thing I do like about AI is that when it is referencing or when it is saying something, it's usually referencing. So you can at least click the link to see where did they get that information, and then you could see if it's a scam or not, really.
100%.
Not a
And
scam, but
and even if it's polling from like PubMed or a peer-reviewed journal, is it able to fully analyze this study
hmm
and give the result? Yes, if you prompt it to,
yeah.
right? But most of the time, it's just going to read through the abstract and say, this is what the research showed. When you go through and you're like, well, was it correlation or a causation? What was the methodology? What was the sample size? Did they actually have a control group that was getting sham intervention? Or
hmm
was it compared to a different variable? What led to this outcome? Was it biased? Like that takes human eyes to go through and see that, unless, again, it's prompted to do that. So I think as we get better at prompting, it can become a better assistant.
hmm
But I still don't think that it's going to have the ability to overtake the professional.
Yeah. Awesome.
Yeah.
Do you have a hope story that you'd like to share?
Well, I think in light of that, it's the human element to me is the hope story.
Hmm.
And when we're able to take away some of the administrative burdens and some of the bureaucracy aspects of it by having AI come in and help, it clears time to be able to have more with people.
Hmm.
And I think that's what people appreciate the most is one, they want to feel better. They want to know they're going to be okay. But two, they want to be seen, they want to be heard, and they want to feel cared for. So I think it is incredible that we have that. And I think as a human, knowing that the human, I think of like robotic assist surgery, of
Mm.
like, hey, the robot's not doing the surgery. A surgeon is behind the control panel still doing the surgery,
Yeah.
right? And that care for the human to go, hey, let me learn how to use these things to better serve the human is awesome. It's not replacing, it shouldn't be replacing, it should be adding to how much that we can care
Mhm.
for an individual.
Yeah, so maybe if you're a listener and you're not a physical therapist or in the healthcare field, but you're just a listener, one, thank you for being here. But also, like, I'm sure, I would guarantee that most people know someone who are encountering some sort of pain,
Mhm.
whether it's health related or like in regards to like, cancers and things like that, or it's physical or it's emotional, whatever. Like people are almost always connected to someone who are struggling. And maybe this episode is a reminder that your human voice is important and maybe needed for their encouragement and love today. So reach out to them and don't just text them, but like give them a call. Or if you text them to like meet up in person because the healing presence of friendship and of community and of just having another human in your life is real and underrated, I would say. And
Mhm.
so I would just maybe give that to our listeners.
Yeah. Yeah. And I don't know if I made this point earlier, but I also want to put in here that um, AI also hallucinates and makes up references
Yeah.
and sources. And not that humans don't do that
Yeah.
as well, but just note that like, hey, that happens, and we've seen some major policy documents that have come out in the past few years
Hmm.
with made up researchers, made up documents, it's completely made up things. But one thing that will not be made up is when you truly care for an individual. You
Yes.
you can't fake that. If
Hmm.
you do it, you get found out real quick.
Right.
So
Yeah.
like truly caring for someone is it's real, and
Hmm.
you can't replace something that's real with something that's artificial.
Yeah.
So Miranda, thank you for that
Hmm.
question. Thank you for listening. Have a great week, and remember, high performance isn't just about using the strategy of hope; it's about becoming hope.
Thank you for listening to the Hope Not Nope podcast. Please subscribe and share this episode. This podcast is for educational and personal development purposes only and is not considered health or medical advice. For personalized support, connect with a Hope Coach at hopenotnope.org.